In physical therapy, it's easy to find yourself in the midst of life-changing moments, especially when it comes to our geriatric patients. Welcome to The Learning Curve with Castelle, with me, Castelle, where we explore the strategies, challenges, and breakthroughs that shape the future of physical and occupational therapy. Today, I'm joined by Amy Shevlin, a true expert in geriatric care with almost 3 decades of experience. Amy has spent much of her career working with elderly patients, many of whom face multiple chronic conditions, and she's here to share her insights on everything from the challenges of home health care to empowering patients with self-management tools. Amy will also be discussing her upcoming live webinar, Therapeutic Management of Heart Failure, where she'll dive deep into the critical role therapy clinicians play in improving heart failure outcomes. So, if you're ready to take your geriatric care to the next level, this is the episode for you. So why don't you tell me a little bit about yourself that I wouldn't necessarily know from your summit profile?
As you know, I've been a physical therapist for close to 30 years now. Well, it'll be 30 years this year. And so physical therapy is just like part of me at this point. I really love what I do as a physical therapist. And I think it carries over into other aspects of my life. I really believe in the power of movement and exercise, and my kids often joke that I think that exercise fixes everything. And I say, well, not everything, but most things. And so it's been a big part of my life. But I live in Smithton, Illinois, so I'm outside of St. Louis, Missouri. I have 2 kids, but they're older. So my son is 22 and he is working on his master's. Then I also have a daughter and she's 19. She is a freshman in college and she's going into nursing. So we have, at least she's someone in the healthcare field. So kind of glad about that. And I also I noticed on your LinkedIn, you're a fitness enthusiast.
I am.
I enjoy group exercise, and I'm in the process right now. I think I'm going to go get certified to be an indoor cycling instructor because that's what I love. I love it.
Yeah, that's amazing. My mom is a cyclist and I have never been able to keep up. I have so much respect for anyone in the saddle because it's intense. It's what and even the indoor classes, you are set to meet your maker on the bike that day.
You are. You really are.
Yeah, it's a lot. Yeah, that's so inspiring though. Good for you.
Yeah, I'm excited. As you know, with Summit, I enjoy teaching, and so I think that would just be another outlet for me to be able to do that in a different way. So,
Yeah,
yeah,
love it.
yeah.
Love it. So you've been working in physical therapy for almost 3 decades now with a significant focus on geriatrics. What has been one of the most profound moments in your career when you realized the deep impact physical therapy can have on improving the quality of life of elderly patients?
That's a great question. I think, being a physical therapist as long as I have been, there's been so many moments over my career where I've just by providing my physical therapy services, I've been able to make a profound difference in a multitude of patients' lives. And so it kind of, at this point in my career, has kind of blended into this full feeling, just like I've really accomplished something with my career and made a huge impact in my patients' lives. But one particular patient comes to mind. This was probably close to 20 years ago. I had a patient who was involved in a motor vehicle accident. Somebody ran a red light and hit her. And she had multiple fractures, like arms, legs. She had a head injury. I mean, she was very, very lucky to be alive. She had one of those external fixators on her leg, so that's where all the pins and things are outside the body. So she couldn't put weight on that leg. And then she had an arm with a fracture that she couldn't put weight on. So she was really, really limited. And so when we first started seeing her, our focus was just getting her from her bed to her wheelchair so she could get out of bed. So we worked with her on that for a while. And then she got to the point where she could weight bear. And so then we just had to work on standing. And her body had not been in a standing position for a couple months. And so her blood pressure was a real issue when she stood up. You know, she would get very lightheaded. And so we worked on that for a period of time. We got her to the point where she could tolerate standing. So we started working on walking and, you know, slowly building up her distance and her ability to the point where we were able to take her up and down stairs so that she could get outside her house. So at this point, it's winter, and it was pretty cold. And I'm kind of wimpy when it comes to cold weather. I'm not super tolerant of cold weather. And so, you know, I'd come running into her house all bundled up in my coat. And one particular day, she says to me, "Leave your coat on. We're going outside." I was like, okay. And then she said, "When you come, that is the only time I get to go outside." And I was like, wow. Like, here I am taking for granted being able to get out of my house and walk outside. And here's this person that I've been on this journey with to the point where she can get back to being outside and enjoy just the outdoors. So that moment really kind of stuck with me, and it helps me, you know, as I'm working with other patients and it's winter time or whatever, there's something that maybe I'm a little not opposed to, but not really wanting to do, keeping in mind that their perspective might be different. And so just having that conversation, and even though it's 20 degrees outside, that patient may still want to practice going outside regardless of how I feel. So kind of it helps you to put yourself in your patient's shoes a little bit, those types of moments. So yeah.
What a powerful perspective.
Yeah, for sure. For sure. Yeah. Yeah. Isn't it funny how little moments like that just really stick with you over the years? And like I said, I think it was 20 years ago or so, but I kind of laugh about it now.
Yeah.
So
Yeah. So I liked what you brought up about going to visit this patient, because working in home healthcare often brings you into patients' most personal environments. So can you maybe share a story of a time where you witnessed a breakthrough moment with a patient in their home that changed both their life and yours?
Oh, yes. So yes, that is what is so unique about home health, is that you are going into their personal environment. You get to know just not the patient, but their families, their pets. So it really is a pretty close relationship that you establish with your patients. Um, but one story comes to mind. So this was a patient that we had. She had just been in the hospital. She had heart failure, and she was hospitalized because of her heart failure. She was able to come back home. And then, you know, just as soon as I was pulling up to the patient's house, it was a beautiful home. It was kind of out in the country a little bit with some rolling hills, and it was this gorgeous big home, complete with like a gated entry where you had to put in like a little key code to get the gates to open to let you in as you're driving up her long driveway. There's like horses in the pasture. It was gorgeous. And then you get to the patient's house, and, you know, she let me in, and then it was obvious fairly quickly that she was really struggling to manage her home. She was somebody who obviously took a lot of pride in her home and how it looked. And once you got inside her home, you could see that maybe she wasn't managing being able to like put things away or clean as well as she could. And so like she always kind of sticks with me, but she was telling me that when she went to the hospital, she had gotten so weak that she had fallen. And she lived there by herself. And unfortunately, I think she stayed on the floor for maybe 4 days, something like that. Yeah. So it was, yes, it was a very long time that she was on the floor. And I think eventually a lady that came to clean her house found her. So she was on the floor for a period of days. So obviously, that was quite traumatic for her, very traumatic. And she shared with us that this was a huge fear of hers. Like, what happens if I fall again? I don't want to spend days on the floor again. It was just a huge, huge concern. But her mobility was pretty limited, and so the thought of being able to get on the floor and get back up was a bit challenging. And so the occupational therapist that I was working with, her and I decided to go ahead and do what we call a co-treat, where we went to her house at the same time to address getting on and off the floor, because this was something that she really wanted to be able to do. So we met there at her house. We kind of arranged our schedules. We met at her house, got her on the floor, and we have a typical technique. Like we always teach patients, of course, first make sure nothing's broken, make sure nothing's hurt, and then kind of get yourself over to like a recliner chair or something where you can use the chair, kind of get up on one foot and then just kind of scoot your hips into the chair. But she was really struggling with that. And, we tried one way, she couldn't do it. We tried turning the other way, she couldn't do it. And we really wanted her to be able to do it. We weren't going to just lift her into the chair, because obviously the goal was for her to be able to do it herself. And so we finally, we tried this, we tried that, we were putting our heads together. And then she had like a coffee table fairly near the chair that we were trying to get her up into. And there's some books there. And so we said, well, why don't you do this? And we took some of those books and stacked them on the floor so that she could get her arm in a better position and get a little bit more leverage. And that was the trick. She was able to, from that point, get herself up off the floor and into the chair. And it was just that moment, like, she was exhausted by this point because we were trying so many different ways. But she got into the chair and she just kind of let herself lean back. And you could just see, like, the stress melting from her, just that moment of relief, like, oh, I did it, because it was such a huge concern of hers. And now she was able to know that if it did happen again, she would be able to figure out a way to get herself up. So, yeah, pretty significant.
That's huge and so empowering. And I think that one thing that a lot of patients deal with is just this constant sense of frustration. And I'm sure that seeps to, your feelings as well. So considering that so many of your patients live with multiple chronic conditions, how do you emotionally and mentally support them when they're feeling overwhelmed by such conditions without veering into getting compassion fatigue for yourself?
It's not easy, because, like you said, it is very overwhelming to our patients, but it's also, as clinicians, it's overwhelming to us as well. When you have a patient dealing with so many chronic conditions, a lot of times you don't know even like where to start. And I think it comes down to having that conversation with the patient to find out kind of what they are working towards, what are their goals. And I think one of the biggest frustrations with people living with chronic conditions is they feel like they've lost control of their bodies. Things used to be one way and now they're not anymore. And that can be very frustrating. And so I think a part of what we do as therapy clinicians, as health professionals, is just having that conversation with our patients, saying, yes, I understand that things are different now and you may not be able to do things in a way that you used to, but that's what we're here for. We have those tips, we have those tricks. We can figure out a way for you to still engage in a particular ADL or functional mobility task that you haven't been able to do. It may not look the same as it did before you had that condition, but we can work together and try to figure out a way for you to get back to doing that. And so I think in that respect, it gives the patient a little bit more control over the situation. And I think also is just being kind of, realistic with the patient and, helping the patient understand that yes, things are different now. It's unfortunate, it's not fair, obviously, but there are tools that we can use to keep you moving and keep you doing the things you love, spending time with your family and all of that. So yes, and it is very overwhelming. And you touched on the compassion fatigue, and that's definitely something that's a real problem with clinicians, because yes, you are dealing with these people that are having major changes to their lives. And I think it's taking care of yourself, making sure you're staying healthy, eating healthy, exercising, but also having that support network that you can lean on. Where I work now, we have a pretty close knit group of clinicians. And so we tend to kind of support each other when we have those particular types of moments, because yeah, it can be a lot. So, but it is, flip it around, it can be very rewarding, just thinking about like the patient being able to go outside again. How rewarding was that for me? And so you really try to keep those types of moments in mind as you're, navigating your way through all of your patient care, just trying to remember those moments where you really did have a huge impact on your patient's life. So
So now, in those situations, what do you believe is the key to fostering the kind of trust with your patients that is necessary to help keep them motivated through the hard times?
So, as far as just developing a sense of trust with my patients, I rely on a technique. It's called motivational interviewing, and it's an evidence based model that helps to improve patient adherence. But a lot of the model is built around that relationship that you have with your patients. And one of like the overarching principles of motivational interviewing is that we have to recognize that our patients are the undisputed experts on themselves, right? And so they're bringing a lot of that into the relationship, so it becomes more of a partnership. I have the clinical knowledge, they have the knowledge about themselves and the barriers they're experiencing in their lives. And so I think if you're kind of meeting them halfway in that respect, you gain a lot of trust. And then another big aspect of it is, so, there's a lot of talk about empathy, and empathy is very, very important as far as establishing a relationship with somebody, building trust. But motivational interviewing really emphasizes what they call accurate empathy, and that is your sincere desire to really truly understand things from your patient's perspective. And so asking your patient the questions, all right, well, what is keeping you from being able to walk around your home? Is it pain? Taking the time to ask the patient those types of questions, that patient's going to perceive she cares about me, right? She cares about me as a person. And so I think that in itself builds a lot of trust. So it's taking the time to get to know the patient. But in the end, as a therapist, that's really going to help me out, right? Like if I'm trying to get my patient to do their exercises and maybe they're not doing their exercises, but I know her goal is to be able to climb stairs, I can say, if we do this exercise, it'll help build the strength in your legs so that you are able to climb stairs. So I'm going to use it, kind of build it into my treatment and my education, use it to my advantage a little bit too, to have better outcomes for my patients.
And I know, especially patients with chronic diseases like COPD or diabetes and heart failure, especially, must present unique challenges. So I liked what you said about the empathy, and I'm wondering, how do you balance your clinical knowledge with that empathy to create a treatment plan that's both effective and compassionate?
So yeah, again, and I think it comes to just taking the time to have those conversations with patients, and then watching kind of your reactions as well. So you certainly don't want to mix in kind of your goals and, what's important in your life. We have to remember that not everybody is going to live in the same manner as we do, right? So, maybe my goal is to be a very active person. My patient's goal may be just to be able to get to the point where they can walk around their home. And so, just having that conversation and trying to find out what is important to my patient without getting all of my goals kind of mixed up in it, and really focusing on what the patient's goals are. As therapists, we tend to get, we have to, as we're doing our documentation, we have to establish goals for our patients. We have to set a goal for how far they'll walk or how much help they need when they walk. And so we tend to get in that mindset like, okay, we've got these goals to meet, but we always have to kind of take a step back and think, okay, what is my patient's goal? And so I think if we're keeping that in mind, that helps to kind of build that relationship a little bit better and allow us to use our clinical knowledge and then balance that with empathy and making sure that I understand what's important to my patient. Yes, I have this clinical knowledge, and there may be times that I know my patient would be able to do more than what they're doing, but it may not necessarily be a goal of theirs. And so I have to kind of work through that with the patient and see kind of, again, what's important, what are some things that we can work towards achieving, and just, again, having that partnership with the patients and providing them the education as far as the benefits of what we're asking them to do, so that they can consider that as far as when they're looking at their goals. So
No, that I love that. But heart failure can be such a devastating diagnosis for patients in particular. How do you approach the specific emotional aspects of caring for patients with heart failure, and how do you help them find hope in their journey toward better health?
So that's a great question. And I think if we just stop and think about what heart failure is, right? Heart failure. Like, how devastating can that be to, for a patient to be told they have heart failure? Like, my heart is failing. And so I think a lot of that comes with patient education. And you'll see that I tend to lean on patient education a lot, but it's crucial. So getting the patient to understand kind of what is happening with heart failure. To give you kind of a little bit of information about what heart failure is, essentially the muscles of the heart are dying. And so it's not able to pump blood as well, and it can't pump blood out to the body as well. But it's a very progressive condition. So a person that has heart failure could still be pretty functional. And then the other aspect of that is there are treatments that can be provided to a patient with heart failure to really help them manage their condition. And if patients follow through with their self-care activities, their heart failure can be pretty well managed. And so a big part of it is just getting the patient to understand what heart failure is and how it is, or it can be somewhat of a progressive condition. And just because they have heart failure doesn't mean they're doomed to live the rest of their life in a hospital bed. They can still have a very active life. But of course, it's going to take some work from the patient as far as taking care of themselves and doing those things that they need to do each day to care for themselves. And I always share this story with my patients. So one time I was teaching my course, and one of the attendees said that his mom had heart failure. And there's this term that we use when we're talking about heart failure, and it's called ejection fraction. So essentially, there's so much blood in the chamber of the heart. When the heart contracts, it's like the percent of blood that is pumped out with each contraction. And a very good way to give an example is like you have a plastic water bottle that has 4 ounces of water in it, and you squeeze it, and you squeeze out 2 ounces of water. You squeezed out half, right? So your ejection fraction is 50%. And so they use this a lot to describe kind of the severity of heart failure. Normal is like between 50 to 75%. And this gentleman shared that his mom had an ejection fraction of 17%, which is relatively low. So you would think that her life would be pretty limited as far as what she could do. And he shared that she lived with 17% for 17 years. He's like, it's easy to remember, 17%, 17 years. And he shared with us that she was still playing tennis during that time period as well. Obviously, she was doing the things that she needed to do to take care of herself, and I'm sure she made changes to her tennis game to make it a little bit easier for her. But, I share her story just to give patients hope that, yes, you have heart failure. It doesn't mean that you're doomed to spend the rest of your life in bed. You can still have an active lifestyle and do those things you enjoy. You just have to, do what you need to do to manage your symptoms.
I know it is so personal for so many people in America, and my grandmother actually has congestive heart failure, and we lost contact after my dad died when I was 3, and I didn't get in contact with her again until I was like 32. Yeah, 32. And so I like finally got to talk to my grandma again. I still haven't seen her in person. And then I learned pretty quickly that she had heart failure and I didn't know anything about it. And all I felt was like, wait, I just found you again. Please don't be taken from me, you know? And so I have this goal of like, I want to hug my grandma again in person. And I really did a deep dive on heart failure when I heard that news because you just even the words you just kind of think like, oh, okay, it almost sounds terminal. And so I do think that it is so important for people to know that you can. And she has a great life. She has a way better social life than I do. So she, yeah. So I do think it's so amazing for so many people to know that you can have a good quality of life with that, and again with the right treatments and the right care. And so I know I am very personally touched by what you do and how you help people because I'm sure you're helping someone's grandma in this.
Absolutely. Yeah. And you always have to remember that this is somebody's grandma, this is somebody's mom. So, yeah, for sure.
Yeah,
Yeah.
for sure.
Yeah.
So now a major theme in your work is empowering patients to take charge of their health. Which I'm sure you might run into some difficulties also with like that generation a little bit. But how do you go about helping patients with chronic illnesses not only manage their symptoms, but feel more in control of their bodies and their lives?
That's a great question. And it's something that, once again, it does take time, right? Like it takes time, it takes effort, it takes patient education, trying to weave in patient education to every session that we have in therapy is really important. And, again, thinking about our patients with heart failure, there are specific things that they need to do to help manage their heart failure. And I think that therapists, in some ways, kind of tend to take a little bit of a back seat to maybe some other disciplines as far as managing heart failure. But if we think about those things that the patients have to do, therapy has a huge role. So, for instance, one thing that patients with heart failure have to do is they have to follow a low sodium diet. Well, it could be this patient can't stand long enough to like make a healthy meal for herself, right? Like she can't. So, what does she rely on? Canned food, which we all know is really high in sodium. And so getting occupational therapy involved to work with the patient to figure out a way to prepare those meals within their activity tolerance is huge. And so I think that just kind of doing what we do and providing that education, and again, making sure our patients understand that things are different now, so we have to figure out a different way to do this, helps to empower them, right? Because it gives them that sense of control over their lives again. And just by, teaching a person how to fix a meal that she enjoys, the family enjoys, is huge because it really helps with quality of life and just feeling like you have some fulfillment in your life. So that's huge. Another thing patients with heart failure are supposed to do is make sure they're following up with their doctors. Well, there's a lot more to it than that, right? Like, you have to be able to have the strength to get in and out of your house. Do you have steps that you have to go in to get into your car so that you can go see your doctor? Are you able to get yourself in and out of the car? And so as we're working with our patients, doing those things that they need to do to care for themselves, they see there is a way. There is a way to continue to have control and to be able to do those things that are necessary to help themselves.
So, you've designed educational tools to help patients decrease fall risk and improve mobility. Can you talk about one tool or strategy you've developed that you've seen make a tangible difference in patient outcomes? And why do you think education is so critical in the rehabilitation process as well?
Great question. And so I think kind of what I've strived to do over the years is find a way to utilize the tools that I have at my disposal, but make them more applicable to my patient's situation. So when we see patients in therapy, we always give them a home exercise program. It's a big part of, therapy, and we ask the patient to do these things in between sessions so that they have better progress. But a lot of times the home exercise programs that are available are designed to meet the needs of many, many different patients. And so because of that, they tend to be a little generic. And so a patient, if we're giving them a home exercise program that's been designed to meet the needs of maybe like 50 different patients, when you give that to them, they're going to be like, does this really apply to me? Like, I kind of feel like we've all been there, like if maybe you've had a procedure done and you've been given your discharge instructions and it says do this and do that and do this. And you're like, they give this to everybody. That doesn't really apply to me, right? And so it's kind of the same thing with our patients if we're giving them these generic programs. And so what I've always tried to do is modify those programs to meet my patient-specific needs. And I'm a huge believer in functional exercise. So what is something that the patient is already doing in their day, and how can I make that into an exercise for the patient? So incorporating some of those functional exercises, making sure that I'm fine-tuning their home exercise program, making sure I'm modifying it to meet their needs. I think that in itself helps with outcomes because the patient's going to see that it's something that's specifically to meet their needs. Another tool that has been really helpful with fall risk is going into the patient's home. We see firsthand how their bathroom is set up, how their stairs are set up. And so we have like a home assessment tool that we can use where we go in and we take a look at the bathroom and we look if there's grab bars, if there's a raised toilet, those type of things. And we make note on this form, and it's just called the home assessment tool. And at the bottom, which I think is genius, is we have the patient sign it. And it's basically saying that these these recommendations were given to me. I understand these recommendations, but I think that by having the patient sign it at the bottom gets a little more buy-in from the patient, right? Like it almost feels a little bit more like a contract with the patient. And so that's been a huge help. And again, using those more personalized home exercise programs, even to the extent that, teaching the patient. So, a big part of like exercising when you have heart failure is making sure that your heart can actually manage what you're doing. And a quick way of doing that is checking your heart rate, checking your blood pressure before and after, and giving them tools where they can track like when they're doing their exercises and what their vital signs were before and after. Really is empowering to the patient. So again, I think education is so important just because with these chronic conditions, these are conditions they're living with for the rest of their life. Like, they're not going away. So they really need to learn how to manage them so that they can live as full of a life as they want. And so that's really where the patient education comes into play. It's definitely something that we want to continue throughout our treatment with our patients. So can't do it just once. We got to follow up. And then a big part of patient education is not just providing the education, but make sure the patient understands. Make sure the patient understands what we taught them. And so we really try to use a tool called Teach Back with our patients, where we'll provide education. And after we've done that, we ask the patient to teach it back to us, just to make sure that we were clear in the instructions that we provided. So that's a really big part of patient education that sometimes is forgotten. So
those all sound fantastic, especially the teach back, I think is so insightful. What's maybe an example of a tool or a technique that someone who's taking your upcoming course will be able to bring back home with them and implement with their patients?
that's a great question. And I just, even going back to the teach back, sometimes that can feel really awkward, right? Like you're teaching your patient and now you're like, okay, can you teach that back to me? It almost makes you feel like you're saying the patient's not smart or something like that. And so one of the things that we do in my adherence class is talk about teach back and talk about different ways that we can ask those questions that feel more natural and part of the treatment than just saying, can you teach that back to me? So that's huge. Another thing, we do spend quite a bit of time in that particular course going through some of the principles of motivational interviewing, which again, I've really leaned on heavily over the years, as far as helping to improve patient adherence. And then just, we also, a big part of that is just meeting our patients where they're at. Some of our patients are more ready to change than others. And so the strategies and techniques that we're going to use for a person that is ready to change is going to be much different than what we would use for somebody who's not ready to change. And so we do spend a bit of time going through that as well, just making sure that, again, we're meeting our patients where they're at. And, it's better for the patient and it's better for us, because sometimes you feel like you're banging your head against the wall. And so using the right technique to the point where you can progress a patient through those stages of change is important. And then we also do a little exercise where we talk about our own selves and like maybe a health behavior change that we're working on. And we go through like different little exercises we might do with our patients as we're like for ourselves trying to make a change. So we all know that health behavior change is hard. It really is. Especially for somebody who has multiple chronic conditions, and they're dealing with pain, they're dealing with shortness of breath. It is so much more difficult. And so, just spending some time and thinking about that and understanding the perspective of our patient.
So that like instantly piqued my curiosity when you said the health change. Can you give me an example of one that you're working on?
Absolutely. And it's been a struggle for me for a while. Diet soda. Like I try not to drink
I'm
diet
not sure
soda.
how to say the brands, but do you have a brand that
I
particularly
do.
over?
I
You
do.
do. I find that people are pretty,
I'm
yeah.
obsessed with Coke Zero.
Coke
Coke Zero.
Zero.
Yes.
So, but you're not getting hooked on the caffeine then.
No, I don't know what it is. It's just the bubbliness and I don't know. Yes, it's not I don't think it's the caffeine. I think it's just the bubble. And it's a mental thing too, right? Like we get so like attached to these things, don't we? And yeah, so that's been kind of a struggle for me, but I'm doing better now. I haven't cut it out completely. But I use it as kind of like a reward throughout the week. If I don't drink it throughout the week, I get to really indulge on a Friday and go to I forget what the name of the gas station is. but get the biggest like soda that I can and just really indulge myself on a Friday. So that's kind of worked for me. Of course, there's times where I've maybe traveled or something and I kind of slip out of it and start drinking a little bit more. But I always kind of come back to the, using as a reward for myself on a Friday after a busy week. So
Yeah. I love I personally have been trying to, again, also with diet, I have the palate of a 5-year-old autistic child because my palate never grew up. And to kind of transition myself away from ice cream with like a ton of preservatives, now where we're at is we got a homemade ice cream maker, we do Greek yogurt and sweetened condensed milk. And it's different, but the 5-year-old in me will still accept it. So it's a big step up from
absolutely.
like a full pint, and it's just Greek yogurt.
Yeah,
So
yeah. So good for you. Yeah.
but yeah, I think a lot of us are trying to implement a health change, and I think that's really impactful. Just sharing them with your students as well, because it does help you connect to your patients, and
Oh, for sure.
just for everyone to kind of share, like, yeah, we know how hard it is to make those changes, especially anything that comes to like routine or sweet treats,
Right. Yeah. That's
so,
amazing. I have a quick little story. So I just was in Memphis like 2 weeks ago teaching my course, and there were several attendees that actually stayed for both days. So they stayed at the hotel there. And we did go through the exercise, and I was having them on a scale from 1 to 10. How important is this change for you? And then on a scale from 1 to 10, how ready are you to make this change? So these are some things that we can do with our patients. So they all did this on a little note card. And the next morning, it was early, and I got on the elevator with one of the attendees. And she was dressed in her workout gear. And she looked at me and she's like, "This is my 10." And I was like, "What?" I was like, "Oh, yeah, yeah, yeah." And then I got off the elevator and I was like, "Oh, that's her 10. How exciting." I loved it. I was like, "You just coined a phrase right there. This is my 10." So anyway, that was pretty cool. So that was a good moment.
yeah. So now, what do you do when you're faced with a patient who may not reach their goals? Like you said, the willingness to change and the readiness to change. But maybe you still know that they've made significant strides. So what do you do in a situation like that?
Again, these situations are not easy, and it's something that a lot of clinicians really struggle with. And I think that the first part of it is just making sure that the patient's goals are realistic. Once again, understanding that life has changed. This is our new normal, and making sure that the goals that we have are achievable. If your goals aren't achievable, you're really going to lose any sort of self-confidence or sense of self-efficacy that you have to achieve that goal. So the big part of it is working with the patients, teaching them ways to modify that activity so that they can still participate. When we do get in situations where maybe patients aren't meeting their goals, but they're still making good strides and they've made great progress, we really just have to spend time focusing on the small wins with these patients and making sure they understand where they started. Because a lot of people forget where they started. And so, because we're so focused on how things used to be. And so, if I'm doing a reevaluation with my patient and I'm doing a particular test that I did in the beginning, and they've made improvements with them, I'm going to share it with them. I'm going to be doing my documentation so I don't have to do it when I get home. And I'm going to be sharing with them that, when we did this test last time, you could only do it 20, and today you did it 35 times. And so sharing those small wins with the patients can be super impactful with that. And just finding different ways to do things and to be able to enjoy those activities. A particular patient comes to mind. He was a retired farmer. And if you know any farmers are farmers for life. They don't ever want to give it up. Like they want to do that forever. And so I was having a conversation with him about what his goals were. And he's like, Amy, you write whatever you want on that page. I'm not going to talk about what my goal is because it's too depressing. And of course, his goal was to get back to farming. But he was living with a condition known as pulmonary fibrosis, which really was impacting his ability to breathe. He wasn't able, it was not realistic for him to be able to get out and farm again. And so, with a lot of work with him, working with his wife, and just trying to find those activities that were similar to what he was doing. So maybe it was getting on their, outdoor vehicle and maybe riding around with their son as the son was doing the farming, or possibly like helping to oversee the garden that they're planting. So trying to find those ways that he could still have some of that enjoyment, but maybe just in a different way. So kind of modifying what the goal is, and again, making sure that the goals are realistic for our patients with their current health conditions. So
I just think that's so powerful, because I know like farmers in particular, and I know quite a few, are their job is so fundamentally a part of their identity. So when your body gets in the way and no longer behaves the way that you've built a life around it behaving, that can be so upsetting. And I know that extends to a lot of other people and a lot of other situations and a lot of other professions, or no profession at all. So yeah, I think that makes a lot of sense.
yeah. And it is like what we do for a living is a big part of ourselves, isn't it? So especially with farmers, for sure. Yeah.
And PTs.
And PTs, of course.
So where can people find you next?
Pardon?
Where can people find you next?
Oh, so great question. So I do, like during my courses, I do share my email address. You can also find me on Instagram, Amy Shevlin PTDPT. I'm going to be honest with you, though. I'm not super good at getting on social media. So, yeah, I can, obviously use that as a channel to reach out to me if you have any specific questions. Also on LinkedIn, again, working on kind of building my profile on LinkedIn. But yeah, anytime anybody want to reach out to me on Instagram, message me. I'm also on LinkedIn, and again, sharing my email address. So for sure.
And if someone wants to take your upcoming course, where can they find you?
Oh, great. So my next course is less than a month away. This next one is a live webinar where we take a deep dive into heart failure. So we're going to talk about therapy management of heart failure. That's on March 22nd. So you just need to log in to your Summit account and look for live webinars, and you'll find it there.
We will also link it in the description of this video, so make it easier for people to find. But thank you so much. It was so nice meeting you and having you on here.
Thank you.
And yeah, I wish you all the best moving forward, and just so appreciate what you do.
Well, thank you. It was very nice to meet you too. It was a great way to start the day, for sure.
Well, that's a wrap for today's episode of The Learning Curve with Castelle. A huge thank you to Amy Shevlin for sharing her wealth of experience and insights into geriatric care, home health, and heart failure management. If you're looking to dive deeper, don't miss Amy's upcoming live webinars, Therapeutic Management of Heart Failure, presented by Summit Professional Education. She'll also be presenting as a live webinar, Therapy Management of COPD, Pulmonary Fibrosis, and Lung Cancer in early April. You'll gain valuable tools and evidence-based strategies to improve patient outcomes and reduce hospital readmissions. Be sure to check out the show notes for more details and easy-to-click links. If you enjoyed today's episode, don't forget to subscribe, leave a review, tell us what you want to see next, and share with your colleagues. Thanks for listening, and keep pushing the boundaries of patient care, because the learning curve never ends.